Can you have a partial dry socket? And if so, how much quicker does it heal versus a full-blown one? 5 days ago, I had 7 teeth extracted. 4 bicuspids, and 3 wisdom. The 4th was removed years ago, the upper 2 were impacted, the lower one was erupted but growing at a slant. I went in today due to mild pain in one of my wisdom teeth sockets, that is controllable with OTC medications of 1,000 mg of tylenol and 400 mg of ibuprofen every 6 hours, per dentist instructions. The only reason I had it checked was the fact no other extractions hurt any lungs. Even the 2 that were surgically removed. The socket that hurt was a wisdom 2 that had erupted but was coming in at a slant. The hygienist said it looked as if it was healing fine, but the location was difficult to spy. The dentist took one look, did something with tweezers and stated I did have a dry socket. I can see part of a blood clot in that space when I look in a mirror. He packed it with some paste after irrigating it and say I may need one more treatment. Considering it really wasn't that painful, and a blood clot was seen. Could it have been a partial dry socket? And how much more quickly will I heal? Also, the other sites, the clots appeared to be shrinking. Is this normal or is something wrong?
Welcome to Just Answer, and thank you for putting your trust in me. Because a dry socket is, clinically speaking, defined by pain, it is a matter of rhetorical debate whether it is meaningful to speak of a partial dry socket. In point of fact, there is a continuum between minimal inflammation and severe inflammation, and it is a subjective judgment just where the dividing line exists between normal postoperative healing and dry socket pain. For the record, dry socket is defined as a localized osteitis, or more simply, a region of inflammation in the bone surrounding the socket of a recently extracted tooth, and this formal definition really isn't all that meaningful in light of the fact that there is always some inflammation in the bone surrounding the socket of a recently extracted tooth. There really is no qualitative difference, it's just a matter of subjective distinction. You should know that although many dentists assume that dry sockets lack a proper blood clot, there are cases of dry socket that are not nearly as dry as the name implies. Especially because the term dry socket is primarily used to refer to the associated pain, and because the methods used to manage dry socket are essentially efforts to control pain, the necessity of treatment would be determined by whether the patient requires additional pain management. Dry socket invariably resolves without any treatment, and the available treatments do not hasten healing at all, they merely make the process a bit less unpleasant. So, considering that your socket really wasn't that painful, one could question whether any treatment was required. As for healing time, there aren't any real hard and fast rules. Speed of healing is dependent on the amount of tissue disruption caused by the surgical intervention, i.e., how aggressively your surgeon implemented his technique, as well as your intrinsic physiology, which cannot be inferred. But since your socket isn't really that painful now, it is likely that your symptoms will resolve within another week at most, assuming your dentist doesn't stir things up too much with his sedative dressing. Hope this helps.
Also, the other sites, the clots appeared to be shrinking. Is this normal or is something wrong?
That's absolutely normal. The red color of the clot gets progressively washed out from contact with saliva, and becomes replaced by connective tissue and surface gum epithelium. In the absence of increasing pain, swelling, or other signs of infection, you can safely assume that healing is proceeding normally. Hope this helps. If my answer has been helpful, please remember to click accept. Good luck!
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.